watching Beat Diabetes Myths and Facts. The COVID-19 pandemic has reached all parts of the world, and just when we thought that we're getting away from COVID-19, Omicron emerged. Now, since it's emerged in mid-November, Omicron has spread across the globe like a wildfire. Though it has milder symptoms, almost the same as a seasonal flu, the World Health Organization has warned that Omicron cannot be dismissed as a common cold or a mild disease, and there are reasons to worry about it. People with diabetes and heart diseases can face severe complications. For instance, due to the previous lockdown and work-from-home culture, people's lifestyles have already been severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which has led to unhealthier lifestyles and an aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetes epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on how to lead a better and a healthier life. If you have any questions that you'd like to ask them, send us a WhatsApp to the following number on your screens, 9167666941. That's the number to send us your questions for our experts, and also do send us your name and your location. Well, joining us on the show today, Dr. R Balamurugan, Chief Diabetologist, Kovai Diabetes Specialty Center and Hospital, Coimbatore. We also have Dr. M G Uvaraj, Senior Consultant Diabetologist, M G Diabetes Specialty Research Center, Salem. We have Dr. Sunandan Sikdar, Consultant Cardiologist, Narayana Hridayalaya, joining us from Kolkata. Dr. Uvaraj, to you first. Is there any data on the time gap of reinfection by Omicron variant among those who've been vaccinated? Can a person, simply speaking, who's previously been infected with COVID, has been given the vaccine, get it again, for instance, in a short time?
Nice question. It's a timely question. Thank you. The reinfection with Omicron can happen as soon as in the 2 weeks or more time after second dose or booster dose. Protection from Omicron after 2 doses of vaccine is between 0 to 20%, and after booster dose it is 55 to 80%.
Omicron was associated with a 5.4-fold higher risk of reinfection compared with the Delta. The reinfection risk estimated, the current study suggests this protection has fallen to 19% an Omicron infection. A new report from the Imperial College of London COVID-19 response team estimates that risk of reinfection with Omicron variant is 5.4 times greater than that of Delta variant. The research from then another study is from Japan. What it says suggests COVID-19 vaccination, breakthrough SARS-CoV-19 to COVID-2 infection offers greater protection against the Omicron variant than do closely spaced vaccination and infection. The length of time between a person's vaccination and the breakthrough infection was strongly correlated with how well the individual's antibodies protect itself against infection, particularly with Omicron. Thank you.
Right. Dr. Balamurugan, if I can come to you, what is the booster dose and how does it help to increase the body's immunity against COVID-19? Who are the candidates, for instance, for the booster dose?
Yeah, good evening. It's a very good, nice question. Actually, when vaccine or antigen is administered for the first time to an individual, there's always a latent period of 7 to 10 days before which the antibody develops. So when this again stimulates immunological memory cells, which helps as a part of immunization. But after a particular time, the antigenic response fades away, and the antibody level also comes down. So to boost these antibody levels, we give a second dose or a third dose, we call it a booster dose, so that the antibody response becomes better. What way the primary vaccination and the booster dose differs is, one, the speed at which or the rapidity at which the antibody develops is faster when a booster dose is given, and more abundant antibodies are produced when a booster dose is given, and the immunity or immunological memory stays for a longer time when you give a booster dose. And again, the binding of the antibodies to the antigen is also better, and the latency period is also very short. These are the various differences between giving a primary and secondary dose of vaccine and the booster dose. And today, many of us are getting the booster dose for COVID-19. And if you look at the last wave of COVID, most of the time people had the vaccination, they had less complications of COVID, and hospitalization and mortality and morbidity is reduced with the people who have got vaccinated. Again, the government recommends now only 60 plus and above, and people with the comorbidities like diabetes, hypertension, heart disease, and the respiratory issues and chronic kidney disease. These are all the vulnerable candidates, apart from the healthcare workers who are being administered the booster or the third dose of COVID vaccine, which is definitely a boon for everyone as on today. Thank you.
Right. Dr. Sikdar, which is the best diet and exercise regimen after recovery from COVID, and what extra precautions should people with diabetes take post-COVID recovery?
There are two aspects to this question. First thing is the diet and the exercise part. So we'll first go over the diet part. As we know, COVID is a situation where the body protein breaks down and there is a lack of immunity. So what we have to do is to increase each of these components. So in order to boost the immunity part, we can have a lot of fruits and vegetables on our palate. There should be cereals, nuts, and there should be restriction of salt, because often the COVID is associated with increased cardiovascular morbidity, hypertension, and autonomic imbalance. So salt should be less than 2.4 grams per day. The oil should be restricted to around 3 TSF per person per day. And we should avoid deep fried foods like pizza, chips, cream, cakes, and other like red meat, etc. As far as the exercise part goes, in short, we have seen that COVID is a situation where exercise, or especially vigorous exercise, have led to sudden deaths. There is an increased chance of arrhythmias occurring during COVID, where the heartbeat becomes irregular and can die suddenly. So very vigorous exercise should be avoided. Drink enough water and always do some amount of moderate freehand exercise, but not on a treadmill. This should go at least for 2 months. After 2 months, you can go for regular healthy exercise. Thank you.
Right. Dr. Uvaraj, whenever we discuss diabetes, we speak about insulin resistance. What is insulin resistance and how does it develop?
Very good question regarding diabetes. Insulin resistance means you have to go for a basic aspect. There is two types of diabetes are there, type 1 and type 2. This type 2 is insulin resistance. Type 1, before the diagnosis of type 2 diabetes, there is two pathological problems. Number 1, decreased insulin secretion. Number 2, insulin resistance. Insulin resistance is the most etiology part of the type 2 diabetes mellitus. This insulin resistance actually precedes 5 to 10 years before the diagnosis of type 2 diabetes mellitus. The insulin resistance is a condition that patient has lost enough of insulin. It is impaired biological response to insulin stimulation to target tissues, particularly the liver, muscle, and adipose tissue. Insulin resistance impairs glucose disposal, resulting in a compensatory increase in the beta cells, insulin production, and hyperinsulinemia. The insulin goes and attaches the insulin receptor on the cells of the adipose tissue or on the muscle. In case of insulin resistance, insulin will not act properly, so the glucose will not enter into the cell. That's why the increase in level of the glucose in the blood. So insulin resistance is the thought of the precede the development of type 2 diabetes by 10 to 15 years. Development of insulin resistance typically results in a compensatory increase in an endogenous increase in the endogenous insulin. Elevated level of endogenous insulin results in weight gain, which in turn exacerbate insulin resistance. This viscous cycle continues until pancreatic beta cell activity can no longer adequately meet the insulin demand created by the insulin resistance, resulting in a hyperglycemia. With continued mismatch between the insulin demand and insulin production, glycemic levels are to consist of the type 2 diabetes mellitus. So resistance to exogenous insulin has also been described. So with this, I finish my talk on insulin resistance. Thank you very much.
Dr. Balamurugan, what is secondary diabetes, and is secondary diabetes the same as type 2 diabetes? What are the kind of conditions that may lead to the development of secondary diabetes?
Yes, already Dr. Uvaraj said that about what is type 2 diabetes. Major pathological defect is insulin resistance, and the other one, the relative insulin deficiency. These are the two key factors of type 2 diabetes. On the other hand, when you define what is called secondary diabetes, it is secondary to one of the any second pathological conditions which leads to diabetes. Most of the time, the disease of the pancreas, for example, cystic fibrosis and the fibrocalculus disease of the pancreas, sometimes we call as MRDMR, malnutrition related diabetes. These are the conditions which are related to pancreas, which can cause, previously we used to call as the pancreatic diabetes, now secondary diabetes. The secondary diabetes can also be caused by some hormones, which are counter hormones to insulin in excess. For example, the patient with excessive corticosteroids in Cushing syndrome, patients with pheochromocytomas, and patients with excess growth hormone. Such abnormal hormonal disturbances which can offset the insulin can cause the secondary diabetes. Not only these endocrine causes, there are other drugs can also, like drugs on long-term statins, drugs on long-term steroids, some antipsychotic drugs, as well as some drugs taken for these HIV treatment can also cause the secondary diabetes. One of the major difference and advantage of the secondary diabetes is once you are able to remove manage the secondary cause of the diabetes, these diabetes can be reversed. Unlike in a primary or type 2 diabetes, the treatment is lifelong, and the secondary diabetes, if you are able to identify the cause, this can be reversed and the patient can be brought back to normoglycemia or non-diabetic stage. Thank you.
Right, our next questions actually come via WhatsApp. Let me take this to Dr. Sikdar. Does high cholesterol with no other symptoms indicate a heart issue?
Yeah. So this brings us to the important question that whether cholesterol is directly linked to the heart disease. So there is a condition like hypercholesterolemia, familial hypercholesterolemia. In that case, in the early stages of the disease, you can find cholesterol in very high range, especially the bad cholesterol, the LDL cholesterol. That is in a very high range, in the range of say 160 or 190 milligram per deciliter. So this is a bad cholesterol, and we have evidence that in the long run, say in the range of 40 years or 50 years, these patients often have severe coronary artery disease, and they often succumb to heart attacks. So it is very well-known fact that in early stages, there is a possibility that it will be manifesting only as a raised cholesterol, and that in the advanced stages will present as heart attacks. So definitely that can be an early sign of a coronary artery disease.
All right. Well, with that, we're going to slip into a short break. Our panel of expert doctors will continue to be live with us on the other side. Stay with us. Welcome back. You're watching Beat Diabetes Myths and Facts. Pamela from Nagpur has sent us this question via WhatsApp, and I'd like to take it to Dr. Uvaraj at the moment. Dr. Uvaraj, is it okay to eat certain sweets and desserts on an empty stomach or immediately after meals? What is preferred and better for patients with diabetes?
Yeah, this is a very common question daily used to the patient asks to the doctor. Eating sugar or something, desserts for diabetics. Yes, you can have dessert in moderation and with a little planning, as long as it's within the limits of your daily carbohydrate intake. It means watching your portion cycle. It means getting enough fiber and avoiding an overload of fat, salt, alcohol and sugar. Sweets usually have high glycemic index and high caloric value, which may derail proper glycemic control and may cause severe postprandial hyperglycemia. So there is another word is called, now they are watching carbohydrate counting. With this system, you keep track of the grams of carbohydrate, that is starches and sugars, you consume with the idea of spreading them out throughout the day to help keep your blood sugar steadily. In a nutshell, if the HbA1c level is within normal limits, the patient himself can eat sugar or with the protein mixed diet. Thank you.
Right. Dr. Balamurugan, how critical is hypoglycemia or low sugar for a diabetic patient on treatment?
Yeah, hypoglycemia is a very, very common practical condition. Yeah, all diabetic patients will come into their lifetime. And what does it mean actually? When the blood sugar falls less than 70 milligrams, you can develop symptoms related to what we call as one is called the adrenergic symptoms like sweating, tachycardia, and something called neuroglycopenic symptoms, which is due to the reduced blood supply to the brain. Can alter sensorium. Sometimes patient can land into frank coma also. And any diabetic patient, if you see them with altered sensorium or unconsciousness, kindly immediately give them sugar or take it to a doctor and hospital and immediately infuse 25% dextrose if they're totally unconscious, because hypoglycemia is one of the treatable causes of coma in practice. And this occurs only in patients who are taking diabetic treatment, medication or an insulin, and the patient sometimes takes lesser diet and does more exercise, and sometimes the patients take very delayed meal. Sometimes because of our cultural habits, some of our guests are latest come, we don't bother about the time, and but the insulin and medication, they keep on working and push you to low sugar. So how do we avoid this? Is when we have to match your medication, diet and exercise and everything in time. So timing of food is very, very important for all diabetic patients, and the quantity of food is also important to avoid hypoglycemia. And if you are developing hypoglycemia, frequently you have to consult your diabetologist or endocrinologist and modify your medications and take the advice. And very important is there might be a drop of the blood sugar in between your breakfast and lunch, or lunch and the dinner. So what we advise is frequent intervals. You should take something we call as a mid-morning snack or an evening snack and bedtime snacks. These, by taking these one, will avoid the hypoglycemia. And one of the major barriers in the management of diabetes is hypoglycemia. If a diabetic patient develops a severe episode of hyperglycemia and is likely to go in for some time unconsciousness, or sometimes the patient gets so scared that he stops the diabetic medication. So that is why any newer drugs which are developed today in diabetes, the American Diabetic Association and RSSDA and all the drug control of India and stakeholders like US FDA, they all mandated that any new drug developed in diabetes should cause very minimal or less hypoglycemia. Especially if the hypoglycemia happens in the night, we call it a nocturnal hypoglycemia. It's quite dangerous. So any drug which is not developing the hypoglycemia is always better, and that's how the newer drugs are developed. And so when a person gets hypoglycemia, he has to be educated on what is hypoglycemia. Any diabetic patient comes into a clinic, a diabetic educator or a dietitian will educate on various symptoms and signs of hypoglycemia and how to manage it. If you can take a simple sugars, hypoglycemia gets all right. And this is why the monitoring of diabetes is very, very important. Today, we are doing the glycemic excursions, continuous glucose monitoring systems are used by the glucose sensors, which measures the blood sugars 24 hours so that we can predict which time the patient goes in for hypoglycemia and reduce the dosage of the insulin or a tablet and modify the diet accordingly so that patient, the frequency of hypoglycemia is less. If a patient develops frequent hypoglycemia, the quality of life is also affected. So this also is a very major concern. And sometimes in the long-term diabetic patient with the neuropathy, they lose the warning signals of hypoglycemia. This is called hypoglycemia unawareness, which is very, very, very dangerous. So all diabetic patients should be educated and the family should be educated on what is hypoglycemia and symptoms, and which is easily manageable by anyone. It does not need a doctor or a hospital if it's found early. Thank you very much.
Right, Dr. Sikdar, if I can come to you, chest discomfort is the most common symptom of a heart attack, which can be life-threatening, but it can also be a sign of heartburn, which has nothing to do, with the heart and is actually a common symptom of indigestion. So how can one really distinguish between heartburn from a heart attack?
So this is a difficult symptom to decipher, particularly for the common people, because in our society most of the heart attack goes by the name of heartburns. So a lot of patients are undetected at the proper time when they could have reached the hospital in the golden hour and been treated for a heart attack. It was because that they thought that it was because of heartburn and it is very mild thing that they stayed back in their homes. So most of the times the best way to differentiate the innocuous heartburn from the very serious symptom of a heart attack is to get to the basics of this disease. So if a patient has symptoms of breathlessness, symptoms of sweating, and symptoms like dizziness, along with the history of chest pain, that is a bad pointer. So these are the patients who actually require an immediate attendance of a medical practitioner, and he or she should undergo an ECG test as early as possible. Even after ECG tests, sometimes it is very difficult to determine whether it is from heart attack or from a heartburn, because ECG sometimes is not suggestive. In those cases, further test is required under the supervision of a medical practitioner. So, if you have a symptom and you have associated symptoms like breathlessness and you have some risk factors like diabetes, risk factors like kidney disease or hypertension, you should not wait at your home and immediately go and see a doctor. And if there is some smallest of presumption of a heart attack, never go back to your home, get an ECG test done, and other tests like troponin or echocardiography should be done to rule out a heart attack, because that is the main thing that always is a life-threatening disorder in many cases. Thank you.
Right. Thank you very much, doctors, for sparing your time and being with us on NDTV. With that, we're slipping into a short break. News and updates on the other side. Stay with us.